Hello everyone, my name is Dr. Sanket Pisat, and today we are going to be discussing a very common surgery which is laparoscopic sterilization surgery or permanent sterilization surgery, which is one of the very common questions that patients come to us with in the OPD. So first of all, what is actually done and how do you ensure permanent contraception by a surgeon? The surgery in itself is rather straightforward. In our previous videos, also, we have discussed how the anatomy of the uterus and the fallopian tubes is, and that the fallopian tubes are the one which are responsible for carrying and making the ovum from the ovary meet the sperm which is deposited in the vagina. In effect, the fallopian tubes are the communication between the male and the female gamete, which results then in fertilization and the formation of a baby. So, what happens or what is done in female sterilization is that these fallopian tubes are blocked by some way or the other, thereby making sure that the ovum from the ovary and the sperm in the vagina, they are not allowed to meet each other, and hence there is no fertilization and no pregnancy that happens subsequently. How exactly is this done? This is done by applying a band over the fallopian tube, laparoscopically, of course, which means that there are one or two small incisions which are taken on the tummy. And using microsurgical instruments and magnification, the fallopian tube is then visualized. Once the tube is visualized, a very small band, which is a silicon band, this band measures hardly 2 or 3 millimeters in size. It's seen, of course, very much enlarged in the laparoscopic view, but this band is placed on the tube, and this band blocks a loop of the tube in order to kink the tube such that there is no possibility of communication of the sperm and ovum either way. So this is the procedure of banding, which is considered as the simplest procedure and is approved all over the world and also by the government of India. Some people have the misconception that the tube is completely removed out. Generally, this is not done unless the tube is deceased, for the simple reason that banding also gives you the option of reversing the tubal sterilization if you wish to at a later date. Of course, the tubal reversal of sterilization surgery is much more difficult than the tubal ligation surgery, but nevertheless, it is possible. If the tube is removed completely, then this sort of reversal is not possible at all. Uh, the other question that patients come to us with is that, is this a 100% effective procedure? Well, no. There is obviously a failure rate of a few, say 3 to 4 per a lakh of women, but this rate is very, very less. And amongst all available contraceptive measures, this is the least possible method which is likely to fail. However, the patient needs to understand that in case the patient does miss her period even after doing a tubal ligation, which is possible because sometimes the band may slip off, the band may cut through the tube, and multiple other such things may happen, though the chances of this happening are very, very less. Nevertheless, if a period is missed even after doing a tubal ligation, the patient needs to report to the doctor immediately. Other common questions are of side effects. Patients ask whether there is obesity or any increase in the size of the tummy by gaseous distension after tubal ligation. And this is an absolute myth. There is no increase in obesity. There's only probably the excessive rest that patients take and excessive food intake after doing this tubal ligation, which may lead to a basic obesity. But however, there is no relation between fertility, between contraceptive surgery and increase in the weight gain. There is no change in the hormonal pattern after doing tubal ligation. Some patients may have some transient complaints as related to hormones, but generally this does not happen. And there is definitely no change in, or there is no loss of sexual function in any way after doing a reversal surgery, after doing a tubal ligation surgery. Recovery after tubal ligation surgery is very fast. Since there are only 1 or 2 cuts on the abdomen, the recovery is very fast. The patient is usually able to go home the same day after the surgery has been done. The rest period is hardly 6 hours, and patients can resume work by the second or third day. And once the dissolving sutures are completely dissolved by the 7th to 8th day, you are 100% sure that this chapter has been finished, and there is very, very little possibility of having a pregnancy then in the future. So all in all, it is a very simple surgery, quite easily done, almost a daycare surgery. One does not need to get admitted in the hospital, and with a very, very high success rate, and definitely recommended for someone who has completed their family and the kids are rather old, so that the repeated stress of using a contraceptive in every cycle is eliminated, and once and for all, this surgery takes care of the contraceptive issue. So if you have any questions, please leave them in the comment section below. And if you like the video, please click on the icon above to subscribe to our channel and to keep receiving more such updates. Thank you so much.